The tragic death of 71-year-old Canadian visitor Leroy Taylor at the Sangsters International Airport has cast a glaring spotlight on the inadequacies of Jamaica's emergency response systems. With delayed medical care and bureaucratic red tape overshadowing what should have been an immediate and life saving intervention, this incident raises critical questions about the responsibilities of airport authorities and healthcare providers. As Inside Business delve into the circumstances surrounding this preventable tragedy, it is clear that significant reforms are needed to prevent similar disasters in the future. The incident not only reflects poorly on our national image, but also calls into question our commitment to the safety and well-being of visitors and citizens alike. Make we talk. The recent tragic death of 71-year-old Leroy Taylor at the Sangsters International Airport has highlighted critical failures in Jamaica's emergency response protocols. Mr. Taylor, a Canadian visitor, died after falling at the baggage counter, and despite multiple pleas for help, assistance was severely delayed. Witnesses reported waiting over 20 minutes before medical personnel arrived, and during that critical time, the focus was shockingly not on saving his life, but on the cost of transporting him to the hospital. This incident exposes a significant breakdown in emergency preparedness that demands urgent attention. The absurdity of this situation is amplified when we consider how quickly authorities can act in other scenarios, like for example, when your car is towed without a second thought, often without the driver's consent. Yet, an emergency, when a person's life hung in the balance, airport officials pause to seek permission for ambulance transport. Who would ever say no to saving a life? This glaring contradiction reveals a system that is more efficient at removing vehicles than responding to human emergencies. It is not just ironic, it is unacceptable. No, sir. Firstly, the airport's response to this emergency was dismal. Instead of swift medical intervention, we heard stories of officials more concerned about $400 cost of a private ambulance than providing immediate care. This bureaucratic paralysis is not just a failure in judgment. It is a negligence that probably might have contributed to Mr. Taylor's untimely death. The rigid adherence to protocol, even in life-threatening situations, must be reviewed. There must be room for flexibility where the priority is saving lives, not arguing over bills. Come on, man. Moreover, the tragedy reflects a broader issue with Jamaica's healthcare system, particularly in the Western region. The Cornwall Regional Hospital, the main facility in Mobay, has been struggling with severely reduced services since 2018. Reports of inadequate emergency services, only one working ambulance, and insufficient medical staff has left both residents and visitors vulnerable. It's not just a matter of poor service, it's a public health crisis that endangers lives every day. The reputation of our airport, one of the main gateways to Jamaica, is at stake. This incident, coupled with others where passengers in distress were left waiting, paints a worrying picture of inadequate emergency care at one of our country's most busiest hubs. For an airport that sees thousands of visitors daily, this is unacceptable, man. The lack of an efficient emergency response system threatens not only the safety of passengers, but also Jamaica's standing as a safe and reliable destination. To prevent further tragedies, several measures must be implemented immediately. The airport needs dedicated on-site emergency medical staff, including EMTs, and additional qualified personnel trained to handle crisis swiftly. There should be ambulances readily available at all times to reduce response delays. Protocols need to be revised, allowing staff to make immediate life-saving decisions without getting bogged down in red tape. No, sir. Furthermore, regular emergency drills and updated training for all airport staff are essential to ensure that everyone knows their roles in a crisis. The question of liability cannot be ignored. Sangster's International Airport must take responsibility for this tragic failure, and there must be accountability for the staff and the systems that allowed this to happen. Yes. The management must publicly address these shortcomings and commit to rectifying them immediately. Now, in closing, Mr. Taylor's death was not just an unfortunate event. It was a preventable tragedy that demands a serious response. Let it be a wake-up call for urgent reforms in our emergency response systems at airports and healthcare facilities. We owe it to the millions who pass through our doors each year to ensure their safety and provide the care they truly deserve. Only then we can begin to restore confidence in Jamaica as a world-class destination with a reliable and compassionate response to those in need. This is Ozzy G. Thank you.